What's up, you guys? Welcome back to my channel. If you are new here, I'm so happy you're here. My name is Margaret. I am a nursing student and I am 2 exams away from finishing my second cap in my accelerated program. So I'm in a 15-month nursing program. It's a second BSN degree, so I have a bachelor's degree in journalism and communications. I'm going back to nursing school to get my BSN and start a career in nursing. I have been through 16 weeks of nursing school and it has been a wild 16 weeks. There has been a lot of stuff happening, not to mention it is happening during a global pandemic, so it looks a little different than I expected, but we are making it through. And I wanted to share today the top 5 things that I have learned over these last 16 weeks. I hope these lessons and tips can help you on your own journey, whether you are thinking about going to nursing school, you're in nursing school, or I mean, even if you're doing something else. I feel like these are pretty applicable to a lot of things in life, but I found them particularly helpful in my nursing school journey. Without further ado, let's get into it. Number 1 is do not get caught up with grades. I am the type of person, full confession, that gets disappointed if I don't get an A. And there's absolutely nothing wrong with that. There's nothing wrong with wanting to get an A and wanting to strive for, the best grade possible. But something I've learned and something I am really coming to terms with is the fact that grades aren't everything. And they're just one metric of how well you're learning and your success. So like not getting an A doesn't mean you're not doing well. It doesn't mean that you're not going to be a good nurse. Nursing school's tricky and you're gonna get a lot of questions on exams that there are 4 right answers and you just need to find the one that's the most right. And that sounds very annoying, and it is. But that's just the way it is, and that's how the NCLEX is set up, and you need to be prepared to just do that and like learn the strategies for answering those questions and know that sometimes there's gonna be that question that just feels so unfair. That's just gonna happen and you're gonna get it wrong, and sometimes you're gonna get it right. What I would say, my biggest advice, and I've seen this a lot with my classmates in the discussions that we have, is don't get so caught up in individual exams and individual questions. Don't spend your time and energy stressing about that one question you just don't feel like is fair, because it's probably not. It's probably a trick question and there were multiple right answers and you just happen to pick the one that wasn't the most right. That being said, don't hesitate to reach out to your professor and ask to go over the exam. There's always something to be learned there, and you maybe can understand why you got the question wrong, and then in the future you'll get a question like that right. What I am saying is, the grade isn't that important, and what matters is that you are trying hard and that you are doing your best. And that is really going to be the measure of your success. And getting stressed by the little things is only going to weigh you down. Number 2, don't procrastinate, prioritize, and keep a schedule. So yes, this is 3 things in number 2, but they all kind of go together. Stay organized, keep a schedule, whether that's a planner, whether it's your iCal. I use my iCal. If it's not in there, it's not happening. I absolutely love keeping that calendar. It gives me reminders. I'm on my computer every day, so that's helpful for me. But if you need to write it down, and then stick to the schedule. You are gonna have a lot of assignments, a lot of reading. You have class time, you have clinical time, and it's only gonna build on itself. Let's pretend life was normal. I would have had clinical once a week this semester, and starting in the new year, I'm gonna have clinical twice a week, and those are full days in the hospital that I'm not gonna be able to spend studying or doing assignments or stuff like that. So it's very important to stay organized. Along with that is prioritize. So I talked about this in one of my previous videos. I stand by it as being a huge nursing school hack. You are never going to be able to get every single thing done. And by that I mean you're not going to be able to get every page of reading done and every lecture watched and every assignment done and make your study guides and have a Quizlet and etc, etc, etc. So what you need to do is figure out what works for you. Think about the things that aren't required necessarily. So you're reading. If reading isn't your strength, like it takes you a long time, you don't really get that much out of it, and it just is kind of busy work, then skip the reading or read the highlights in the book. Figure out a way to reduce the amount of time that you're doing that, because you're gonna have like thousands of pages to read and it's just not gonna happen. Find out your priorities and then just stick to that, because you'll get too overwhelmed if you try to like start from the top and get to the bottom. It's just not gonna happen. I know when I first started school, I was getting up at 6 a.m. and working until 6 p.m. straight, trying to just read all the chapters and get my assignments done and study for my tests and go to my lectures. So it just wasn't working. It was not sustainable. I don't want to get up at 6 a.m. every day, roll out of my bed and sit at my desk. Like, it's just not gonna happen. And life is gonna get in the way. So that is the other part of this, is don't procrastinate, because things are gonna come up both in school and in your personal life, because you're a human and life is gonna keep going. The more on top of your stuff you are, the easier you're gonna be able to deal with those curveballs. I am 10,000%, I admit, I'm the person that says I work well under pressure as an excuse to procrastinate. I am a huge procrastinator. I just have always done it, but I've pushed myself, especially in this last 8 weeks, to really just try to not do that. And let me tell you, my stress has been cut in like half. All right, number 3, collaborate and help your classmates. Nursing is a team sport. It is a collaborative career. You are going to be working with the nurses on your team forever. It's gonna happen. You're gonna need them. You're gonna need to rely on them. They are gonna need to be able to rely on you. So nursing school can sometimes have this like competitive edge. I am super lucky that my class, my cohort, is extremely collaborative and supportive. Very kind, nice, everyone's there for each other. It's been really a wonderful experience, but I know that there can be a tendency in a setting like this to get competitive and to compare yourself to others, which just is not helpful. You are not someone else. You are not going to get the same grades as them. You might be really good at one thing and they're good at another thing, and the comparison is just going to pull you down. Instead, collaborate, and you're stronger together. If you see a classmate struggling with a skill that you happen to be good at, help them. If you have a study guide complete or a Quizlet, throw it in your GroupMe. Do what you can to boost each other up, and then you'll all be more successful. I feel like the nursing community is moving in a much more collaborative direction. By that I mean just more accepting of young nurses. I don't know if you've heard, like, nurses eat their young. It's something that I heard a lot when I was thinking about going to nursing school, and just kind of the environment of, I don't know, putting new nurses through it. But I think with this next generation of nurses, I've just seen a lot of hope for just a really, really, really amazing career and community. And I hope to be part of, you know, the shift towards nursing being, you know, a really open and welcoming place to be. 4 is, this might be the most important and the biggest lesson that I learned, and that is take every opportunity, absolutely every opportunity to learn. Unfortunately, because of COVID, I was only able to go to the hospital twice this semester. When I did, I mean, my growth was exponential, just because doing things that are hands-on, doing things with real-life patients is truly, it's freaking awesome. Like, it's awesome, and you learn a lot, and it helps you build your confidence. And you know, you're gonna make mistakes. You're just going to, it's just gonna happen, but those are opportunities to learn. And you know, when you are in the hospital, jump at every chance to do something. Dress a wound, give meds, drain those drains, like, you know, do what you can do, restart an IV, you know, I don't know. I mean, there's a lot of stuff you can do. I'm just thinking about skills that you'll learn like early on. Just do those things, like take those vitals. I was always so scared, I don't know why, to take patient vitals because I was like, it just feels strange, I don't know, to interact with someone like that. And if you have a nursing background, you might not feel that way, or any kind of clinical background, you might not get that feeling. But if you're kind of brand new to that setting, it's strange to like get in there and take someone's blood pressure and maybe take a little longer than a nurse, a more experienced nurse would, or whatever it is. Like, but those experiences are going to help you learn. They're going to help you be a better nurse. Your mistakes are going to help you grow, and just get in there and ask for stuff. People aren't always going to open the door for you to try something new. They might not think you can or you want to. They might not even, they might be busy. If it's another nurse, you know, she's thinking about her own stuff that she has to do. It's really up to you to get in there and use your voice to try new stuff, because it's the only way that you're going to learn. So ask to go with the patient to do that imaging study. Ask to dress the wound. Ask to administer meds if you're allowed to. I mean, make sure this is all within the scope of your clinical practice. Like, I don't want to tell you to like go rogue, because there's, you know, limitations to what you can do, but work within those limits and do absolutely everything that you can do when you can do it, because I just think that that is just such an amazing experience, and that's what you're gonna get the most from, truly. It's not the exams, it's not the lectures, it's those real life experiences that's gonna make your time in nursing school. Number 5, the final thing. This is something that you're gonna probably expect to hear. This is the number 1 tip of forever, but it's true that you need to take care of yourself. Self-care is extremely important, especially for my nurses. You're gonna hear time and time again about burnout and compassion fatigue. When you are a nurse, you spend your life caring for other people. There's a big emotional burden to being a nurse. I mean, you're gonna see things and deal with things that are hard. And I have to imagine that if you have a desire to be a nurse, you have an empathetic tendency, which can be a lot to absorb. Helping someone through something is one of the most beautiful and rewarding things, and honestly why I think a lot of us go to be a nurse. That means you need to double down on self-care. You will not be successful if you aren't taking care of yourself. So you need to get sleep. You cannot do this on all-nighters and 3 hours of sleep. You have to eat well, and that's just for your own like mental clarity and just feeling good. I know that for me, when I'm studying, all I want to do is snack, and at the end of the day, at the end of like a busy week, I do not want to cook or clean dishes. I want to order out and I want to eat some crap, because it feels better to eat a burger and fries than it does to make a homemade stir fry or whatever it is. And sometimes I have that burger and fries because that's what I need. But a lot of the time I feel my best and I do my best work when I'm eating well and I'm exercising regularly. I can never say that word. You're gonna teach your patients to eat well and exercise, and you've got to eat well and exercise to be the best version of yourself. You are so, so, so important. And if you want to be successful, you need to make yourself number 1. Okay, I have a little bit of a bonus tip. This is just to wrap up the video, and that is to enjoy it. Enjoy the journey. I think that I've seen a lot of people get super overwhelmed by nursing school and have a little bit of an F this mentality, which is fine. Sometimes you're gonna be stressed, and sometimes you're gonna want to say, F it, I don't even care, I just want it to be over, I'm just gonna get through this week. And sometimes that's what you have to do, is put your head down and get through it. But I'd say overall, and I'd say this goes for everything in life, you get one shot. Getting through things and looking to the next thing, you know, isn't gonna help you live in the moment. Being a nurse is, I know, a big part of a lot of our like identities, and it doesn't have to be everything, but nursing school is part of this journey. I really want to encourage you to enjoy it. Enjoy the challenges, enjoy learning, enjoy this time to be curious. Just take a minute every once in a while and just step back and like remember why you're doing this, where you want to go, where you want to be, and what is happening right now. I like to reflect on like who I was when I started and then like who I am now and all the stuff that I've learned in 16 weeks. That's crazy. Like the skills I had were 0 at week 1 and now here I am just on my way to this career that is so important to me. So maybe this bonus tip is the most important. Just enjoy it. Enjoy your life as it is now. Embrace the challenging moments. And I think that nursing school, I really hope you look back on it fondly as just a big time in your life. So that's all I have for today. I hope this was helpful. I hope this provided some kind of insight. And if you are a nursing student, congratulations on another semester down. Please enjoy your break. Take lots of naps. Eat a lot of good holiday food, enjoy your time off so you can come back ready to go. If you like this video, please give it a thumbs up and don't forget to subscribe because I put up a new video every Monday. I'll see you guys next week.